Hello there, I'm Dr. Ball, and welcome to my YouTube channel. I'm here to discuss and talk about various disease processes and how they may affect and impact you. Some of the disease processes I may talk about you've been diagnosed with, and for whatever reason, you don't have a full understanding of a diagnosis that's been given you. You don't know how it may affect you 5, 10, or 15 years down the line. Well, you come to the right place, because I'm here to give it to you straight. I'm here to be forward and forthright and candid with you, because I believe the best patient is the informed patient. A lot of times, if you don't know, then you don't know. But I'm here to help you to know, so that you can be the best patient you can be for you and your loved ones, so they can have you around for a mighty long time. I'm coming in hot. I hope you're ready, because I'm ready. Let's get after it. Hello there. I'm back. Now, we talked about dying as I sleep, as we're literally snoring to death, talking about obstructive sleep apnea. And when I ended the last video, I mentioned there are some things we do and may not realize it that actually makes the sleep apnea worse. Alcohol consumption to the point of intoxication will suppress your respiratory drive and subsequently make your apnea worse. Sedative, for obvious reasons, you're sedate, your respiratory effort is decreased, and you are already having a struggle at work to breathe because of the obstructive sleep apnea. Also want to add testosterone. Yeah, exogenous testosterone or testosterone supplement causes a deeper sleep, and that can exacerbate or make your obstructive sleep apnea worse. You know, there's all kind of hormone replacement clinics out there, and oftentimes they hone in on that one thing. You have hypogonadism, or you have low testosterone, so come to us and we'll fix that. Without thinking holistically or holistic medicine, to think that we're fixing one thing could make another problem worse. And testosterone would definitely make your sleep apnea worse. Now, why is this such an important issue to discuss? Well, there's a high association with untreated sleep apnea and debilitating health. Sleep apnea will eventually cause cardiovascular disease. It will cause you to have resistant hypertension. You're on medicines, and for whatever reason, your blood pressure will not go down. It can cause chronic headaches, most often in the morning upon awakening. You just got this terrible headache. Don't know why. You just have a headache. Well, think about sleep apnea. It can cause something called right heart failure or pulmonary hypertension, as it puts a constant strain on your heart. It can also cause congestive heart failure or left heart failure by the same mechanism. This obstructive process puts quite a variant of change in the intrathoracic pressure, and that subsequently puts an added strain on your heart. And over time, it will cause heart failure. It also can cause stroke. In fact, it's one of the leading causes of stroke. They did a study on stroke patients, and an overwhelming percentage of stroke patients also had underlying or undiagnosed sleep apnea. And it also can cause erectile dysfunction. Basically, your body is made to be adequately oxygenated, and when your body is not adequately oxygenated, there's going to be a negative consequence. And these are just a few. So, first thing you have to do is see if you actually have sleep apnea. And I know with today's economy, most of you or some of you could be listening to this and say, well, that's more easier said than done. I don't have insurance, or I don't have a doctor. And you go and call a pulmonologist's office, or you call some sleep study clinic, and before you can even get on the books, they're talking hundreds of dollars. And so that's discouragement all by itself. But thankfully, there's been some creation or invention, so to speak, of some home devices home sleep study kits that are fairly accurate. In fact, they say they are equivocal to going to a sleep study clinic. And they're between $100 and $200. Now, the issue is this. You have to have a physician prescribe it. The results have to be able to go to that physician so that it can be determined if you actually have sleep apnea or not. And then from there, you can talk about some treatments, which I'll get to in a second. Basically, there's something called a AHI, apnea hypopnea index. The higher that number, the worse the sleep apnea or the increased risk of having sleep apnea. And the lower the risk is less chance of you having it. So if your AHI is less than 5, forget it. There's no sleep apnea there. There's no apneic events in your sleep. If it's 5 to 15, then it's called mild. Okay, so something to watch. You're having pauses in your sleep. This could potentially be unhealthy. If you have 15 to 29, that's moderate. Yeah, you hands down, you need to treat this. And then over 30 is severe. That's the number of times you actually stop breathing for at least 10 seconds in an hour. So can you imagine? You're stopping your respiration with a 10-second pause 30 times in 60 minutes. You do the math, and you know that's not good sleep. And so that's what this test will determine. And then from that, you can talk about treatments. Now, in the medical community, we've kind of done our patients a disservice when in 1981, we first instituted a machine called a Cpap as treatment for sleep apnea. And since that time, everybody has funnel-necked into making the perfect Cpap, tweaking it, making it smaller, making it quieter, making it this, making it that, without ever thinking that you need more obstructive sleep apnea tools in the sleep apnea toolbox. We do it with every other disease process because sometimes the one method of treatment isn't tolerated, and this is one of them. CPAPs have a very low adherence rate. In other words, people just can't stand having that astronaut-looking equipment on their face when they're trying to sleep. It's cumbersome, and a lot of times, sometimes it elicits anxiety that you got this pressure breathing forcefully on you when you're trying to rest. And so it has a low adherence rate. In other words, people just don't wear it. They know they need to. They've tried, but they wake up more tired using it than they do not using it. So they stop using it. And so outside of that, there's all these invasive surgeries, uvuloplasties, where they go in and just literally cut away any tissue in your pharynx, hypopharynx area, throat area, snatch out adenoids, snatch out tonsils, anything to open up the space. What they don't often tell you is a lot of that tissue grows back. Very painful surgery. And it works. 2 or 3 years later, the palate has elongated again, that they trim back. Soft tissue has retaken its place. And you're like, wow, all that just for 3 years of therapy. And you're right back where you started. But there's another method that's not talked about enough. And that's synthetic THC. Trade name Marinol. FDA approved for nausea with chemotherapy. Also as an appetite enhancer for people with AIDS and are just withering away. But as an off-brand, they've done some studies and found out that taking 5 milligrams and is up to 10 milligrams of this synthetic THC, drastically decreased the AHI, the apneic hypopneic index, on the same levels of a CPAP. They found this out almost a decade or so ago. And for whatever reason, they're waiting on that phase 3 trial to go through to get FDA approval. But yet it works. or at least the studies have shown it's worked in the first 2 trials. So you have that avenue. But say the Cpap situation doesn't work. Say you can't find a doctor to write you a prescription for the synthetic THC. There's also lifestyle modification. Yeah. And at the top of that list is weight loss. Weight loss. What we don't realize is when we gain weight, we see the weight in our chest, around our abdomen, maybe for some in their arms, some in their face. But did you know your tongue is a place for fat deposition? Yeah, fat deposits in the tongue. And in the worst place, the posterior aspect of your tongue. You know, your tongue, it goes like this and it goes down. That part in the back that goes down is where we get fat deposits when we gain weight. And they did a study. They measured the tongue under an image called an MRI to look at the fat deposition. And then they had the person lose weight, and lo and behold, their tongue got smaller in the back. And so if you carry an extra weight and you're snoring the way you're snoring and you're pausing in your sleep and all these other things I talked about, you're like, I can't afford that. But you can't afford to lose weight. You can afford that. In fact, it may even save you money. So weight loss is one. And, you know, there's some studies about neck circumference. Most people with a neck circumference of greater than 16 inches is going to have some type of obstructive sleep apnea. But in my practice and seeing patients over 20 years, and when I had my private practice, I've had skinny patients with obstructive sleep apnea. So take that how you want to take it. Sometimes it's an anatomic thing. You know, a person has a very small chin, or they have protruding front teeth, and the bottom part goes backwards, narrowing that airway. So there's anatomic reasons why a person could have sleep apnea. But overwhelmingly, a large part of the people who have it is excess weight. I mean, we live in the country who leads the world in obesity. So it just makes sense. So, in a nutshell, understand the seriousness of sleep apnea. You know, someone saying you're sleeping good because you're snoring is not true. You are struggling to stay alive during your sleep. It has negative sequelae, as I mentioned, heart disease, resistant blood pressure, stroke, erectile dysfunction, chronic fatigue, chronic headache, daytime sleepiness, falling asleep at the wheel. List really goes on. And understand that it doesn't have to be that way. There are things that can be done. First, cinch the diagnosis or confirm the diagnosis. Secondly, speak to someone about treatment options. Yeah, we all know about the Cpap, but what about those other ones I mentioned? And then there's what can you do in the meanwhile or in the meantime? Work on losing weight. Weight loss is fat loss of the tongue. A big fat tongue, because you're carrying a little bit of extra weight, could make the difference in you snoring or not snoring. So listen, if this has helped you at all or helped anybody else you know, click like, have them subscribe, have them ask me questions via the comment field. I'll be happy to respond. And I mentioned earlier about a televisit. Go to www.curtiseball.com. Scroll down, click appointment, and we'll talk about whether or not you might have sleep apnea. You'll tell me what symptoms you have. We'll decide if I need to write a prescription for the home kit. We'll take it from there. I'm here to help. All right? God bless. There's no longer a need to procrastinate. There's no longer a need to hesitate. There's no longer a need to spectate. It's now time to participate. Click subscribe, click like, leave a comment. It may be a disease process that you have questions about. Put it in the comment field. I'll get to you. I can promise you that. I'll see you next week. Click subscribe, click like. I'll see you soon.